Hello everyone, myself lecturer Aditi Anil Kushare, Master of Pharmacy in Quality Assurance Techniques. Today we are going to discuss about the experiments from Pharmaceutics 2. So we will discuss about the introduction to solid dosage forms, that is powders and other oral unit dosage forms. The solid dosage forms are available mostly in unit dosage forms such as tablets, capsules, cachets, powders or tablet triturate. Powders. The pharmaceutical powder is a mixture of finely divided drug and or chemical in the dry form. They are solid dosage forms of medicament which are meant for internal and external use. Classification of powders are bulk powder for internal use, bulk powder for external use, simple and compound powder for internal use, powders enclosed in cachets and capsules, and fifth one, compressed powders, that is tablets, that are also known as tablet triturates. So first one we will discuss about the bulk powder for internal use. Powders are dispensed in bulk when accuracy of dosage is not important. They are supplied in the wide mouth container that permit the easy removal of spoonful of powder. Examples of that bulk powder for internal use are rhubarb powder, BPC, that is known as a Gregory's powder, compound bismuth powder. Second one, that is a bulk powder for external use. These are non-potent substances. These powders are supplied in a cardboard, glass or the plastic container. The dusting powders are supplied in a perforated or the sifter top container. The classification of this bulk powder for external use is first of all dusting powder, then insufflations, snuffs and dentifrices. We will discuss about dusting powder. These are generally applied to the skin in very fine state to avoid the local irritation. Hence, the dusting powders should be passed through sieve number 80 to enhance their action. Classification of dusting powder is medical and surgical. There are two classes. We will discuss about a medical. These are used mainly for superficial skin conditions and sterility is rarely essential. Medical dusting powders are not intended for application to the open wounds or areas of broken skin. Surgical one, these are used in the body cavities and major wounds on burns and on the umbilical area of infants, hence they must be sterile. Insufflations, these are medicated dusting powders meant for introduction into body cavities such as nose, throat, ears and vagina with the help of apparatus known as insufflator. Insufflations should be finely divided powders so that a stream of fine particles of medicaments get applied to the site of application. Snuffs, these are finely divided solid dosage forms of medicament which are inhaled into the nostrils for its antiseptic, bronchodilator and decongestion action. Snuffs are dispensed in the flat metal boxes with the hinged lid. Then next one, fourth class, that is dentifrices, which is tooth powders. These are applied with the help of toothbrush for cleaning the surface of the teeth. They contain the suitable detergent or the soap. Some abrasive substances such as calcium sulfate, magnesium carbonate, sodium chloride are used in the fine powder. A strong abrasive substance should not used as it may damage the tooth structure. Then next, third class, that is the simple and compound powder for internal use. This is the main class of the powder. Each individual dose is enclosed in the paper. In the divided powders, the number of ingredient may be one simple powder or more than one, that is compound powder. The minimum quantity of powder should not less than 100 milligram. Simple powder, a simple powder contains only one ingredient either in a crystalline or the amorphous form, which should be reduced to fine powder and wrapped as individual doses. Compound powders contain the two or the more than two substances which are mixed together and divided into desired number of individual doses. Fourth one, that is powders enclosed in cachets. Cachets are the solid unit dosage form of the drugs. These are molded from rice paper. They are used to enhance the nauseous or the disagreeable powders and are available in the different sizes to hold the drugs from 0.2 to 15 gram of powder. Cachets are of two types, that is wet seal cachets and dry seal cachets. Direction for this is immerse in water for few seconds and swallow with a draught of water. Then fifth one, that is a tablet triturates. These are the powders molded into the tablets. Molded tablets are flat circular disc, usually contain a potent substance which is mixed with lactose, dextrose or some other suitable diluent. Packaging and storage of these tablet triturates are packed in an airtight container to protect from moisture. General method of preparation of powders. During the powdering, weighing and mixing, there is a loss of powder which cannot be avoided. Therefore, calculate the quantity for one extra powder than required. It is difficult to weigh the quantity less than 2 grain or 100 milligram. As we know, 1 grain is equal to 60 milligram. On dispensing balance, therefore, this quantity must be triturated with a suitable diluent such as lactose. The crystalline substances are powdered separately and then weigh the required quantity of ingredient. Mix all the ingredients in the ascending order of their weight and mix thoroughly to obtain a homogeneous powder. Mixing of powders. Powders may be mixed by one of the following methods, that is a spatulation, trituration, geometric dilution, sifting and tumbling. Dispensing of powders involving special problem. A number of problems arise while dispensing a powder containing volatile substances, hygroscopic and deliquescent powder, eutectic mixture, efflorescent powders, explosive substances and potent drugs. So special considerations are done while dispensing such powders. Volatile substances. First problem is for the volatile substances. The volatilization of substances like menthol, camphor and the essential oils may take place. Incorporation in the powders or should be wrapped in the wax paper and outer wrapper may be any thick paper. Then second one, for hygroscopic and deliquescent powder, the powder which absorb the moisture from the atmosphere such as ammonium chloride, iron and ammonium citrate, pepsin, phenobarbitone, sodium bromide, sodium iodide. Such substances are supplied in the granular form or should be double wrapped. For deliquescent substances, wrapping in ammonium foil or plastic cover is advisable. Third one, that is for efflorescent powder. Some crystalline substances become wet or liquefied during trituration. For an example, caffeine, citric acid, ferrous sulfate, etc. This difficulty may be overcome by using the anhydrous salt or an inert substance. Eutectic mixture. When two or more substances are mixed together, they liquefy due to the formation of a new compound which has a lower melting point than room temperature. Example, menthol, thymol, camphor, salol, etc. An equal amount of any inert absorbent like magnesium carbonate, light magnesium oxide, kaolin, starch, lactose is mixed with eutectic substance. Packaging of powder for divided dosage form for internal use should be done appropriately. Double wrapping. White demi paper gives inadequate protection to volatile, hygroscopic and deliquescent substances unless it is lined with grease-proof paper. If greater moisture resistance is required, use waxed paper. The inner paper is cut a few smaller each way than the white demi and it is satisfactory to fold both the papers together. Sometimes it is necessary to wrap each packet externally in a aluminium foil. So in next session we will discuss about the actual experiment. Experiment number 79. Title of this experiment is to prepare and submit the powder 10 packets. In this we are going to study the solid dosage forms for internal use. Proposition 1 are powders containing small doses of potent medicament. Learning objectives are to understand the preparation of powders containing potent medicament and ability to prepare and submit the powder packets in the correct manner. Apparatus required are mortar, pestle, spatula, white paper, etc. Factor calculated as quantity required upon quantity given is equal to 10 upon 1, that is equal to 10. Prescription is given over here, which is denoted by the symbol Rx. This is the prescription given over here. Let's discuss in detail about the formula table. That is type means category, user, role of ingredient, translation means the name of ingredient, quantity given in the imperial system. That these are the quantities given in the Latin terminology, quantity given in the metric system for preparing 1 gram, that is a 1 packet, and quantity taken in a metric system to prepare 10 gram, that is 10 packets. So first of all we have hyoscine hydrobromide, which is used to treat motion sickness and which is used as antispasmodic. Quantity given in the imperial system is 1 grain. Grain into 1 upon 150. So that is, as we know, 1 grain is a 60 milligram. So 60 into 1 upon 150, that is 60 upon 150 is equal to 0.4 milligram. So that is equal to 0.0004 gram. The quantity taken in the metric system is 0.004 gram. This quantity should be calculated with the help of factor. Lactose used as a diluent. Quantity given in imperial system is a quantity sufficient. Quantity given in metric system to prepare 1 gram, that is quantity sufficient to prepare up to 1 gram, and taken quantity to prepare 10 gram, that is 10 packets. So quantity sufficient to prepare up to 10 gram. Direction for internal use only and to be used as directed by physician. So we have, this is a hyoscine hydrobromide, which is a potent drug, so it should be used in the small quantity, and this is a lactose which is used as a diluent. So first of all, I am going to take this hyoscine hydrobromide into this mortar for trituration purpose. After that, I am going to add this lactose into it. First of all, I am going to add only the half amount of lactose and proceed for proper trituration. And after proper mixing of that both the powder, now I am going to add the remaining amount of lactose into it and again proceed for proper mixing of it. After this proper trituration of both the powders, now I will going to transfer this powder into that white paper for double wrapping purpose, and wrapped each single packet, and after that packing I am going to transfer that all the 10 packets into this wide mouth bottle, and then we will proceed for next labeling part. So we will move towards labeling of formulation. Powder containing 10 packets. For ABC means name of patient, register number, that is XYZ means number given in the register, dispensed by PQR, that is name of pharmacist, manufacturing date September 2020, store in cool and dark place, for internal use only, to be used as directed by physician, manufactured by Element Pharmacy Nasa. Result: the 10 packets of this powder is submitted in this wide mouth bottle. The instruction on label as for internal use only. Thank you.